20 trucks actually is almost nothing. It's a drop in the ocean. And the only positive things into this is just that the border have opened for a very short time. But apart from that, the supply that came in is almost nothing. I'm sorry to say this, but it's nothing compared to the needs. 95% of the water in the Gaza Strip is non-drinkable. Even this was the case before the war. So now what we have, when we talk with the people on the ground, and we talk to them every day, like several times a day, even our own staff, they say that they start to drink non-drinkable water. They start to drink salty water, and salty water is from the shallow part of the ground, and which means that the water might not be might give sickness. It's a recipe for outbreaks. And it's a recipe for a disaster. We already have cases of diarrhea, small diarrhea outbreaks, but 40 people in the middle area of Gaza Strip in a school that got diarrhea. And diarrhea can be fatal for small children. It's not something small, it's something that can be that can have that can be deadly for the children or for the elderly people. They don't have enough morphine, painkillers to use for the patients. So what they are doing, they are forced to do operation with not the adequate dose of painkiller. So they describe scene of patients screaming on their beds because they don't have enough painkiller. When they do the dressing, also they don't have enough painkillers. Some operations are done without painkillers. So they don't put the patient to sleep anymore because they don't have enough. There are so many children that are coming with burns. Some of them, again, in Shifa Hospital, they are with 40% to 60% of the body surface burns, which is difficult to imagine because 60% of the body surface is a lot, and burns are extremely painful. And having this on children, it's really heartbreaking, especially when you don't have narcotic, when you don't have drugs to use as a painkiller. As doctors, when we see this, we are clear. There is no justification for this. There cannot be any justification to stop and to prevent morphine to come inside the hospital to operate the people. It's not acceptable. Same for the antibiotic. Same for the bandage. Same for the gauze. We are really calling for this aid to go through. And again, this is civilian people who are just suffering from that and paying the price. And those people are innocent, so it's no justification for us for this situation. Our estimation is there's a few hundreds of pregnant women who are delivering every day. So currently we have women delivering, not in hospitals, not without access to an operational theater in case to do a C-section in case it goes wrong, because operational theater are used for the life-saving, are already in use for the wounded of the bomb or the bombing, and this person cannot be followed. It's the same for the diabetic people. All the chronic disease, they are not followed anymore. Like 70% of the primary healthcare clinics are closed. They are not functioning. We have people ready to get inside Gaza as soon as possible, as soon as the border open. When it comes to supply, we also are preparing for that. We did pass international order that from our supply stock in Europe, in France, and in Belgium. So these orders are done. They are coming in. We have stock in Israel. We will have stock in Egypt very soon. And as soon as the border open, whichever border, is it Rafah or is it through Israel, we are ready to let the supply in. We cannot transport the wounded people, and the wounded people should be taken care of, and the healthcare workers should be able to do their job in safety. There is no reason to threaten them and for them to risk their life. It's been 16 healthcare workers that died since the beginning of the war during their duty. It's a dramatic situation actually, and we really call for a safe place for all civilians, including the healthcare workers, so we can let them do their job, which is to take care of the wounded people.
روحت الشحون. من العملية هذه خربت السنة. بلغت صدق خلينا ننزل شغلنا قبل لقيتها انت بس.
الشحون غادرت المكان، الشحون غادرت المكان ورجعت.
بالك هذا اللي صار اثر معه.
طبعا انا شايف اصابات جوا هي.
ما ادري لا يعني كنت سلسلته بتضربه كمان لا. شكله المصريين صار فيه اصابات.
في ريحة غاز.
ما خدها رنيت له. خلص بحكي مع المكتب. اوكي تمام وصل يعني.
ايش حتعمل زي ما قلت؟
هذا